Let's talk a little bit more about aligner tracking and what we can do about that, how we can facilitate it. I know we talked about compliance documents, compliance protocols. We'd be glad to help you set these things up. But really, in a nutshell, it comes down to tracking, okay? And tracking means how the plastic of the aligner is engaging with the teeth. It should be flush with the teeth at all times. When they move from one aligner to the next and they put it on, if it's not flush with the teeth, then they need to have their chewies. And it really kind of boggles my mind how many general dentists are not only do they not have a document explaining this, they don't have a video, they don't really explain it to the patient, they're not giving the patients chewies. You will not be successful if you're not doing this because the patients don't get it. And if you don't get it, the patients don't get it. So really, you can't just go by 2 weeks, 1 week. You have to really explain there's gonna be steps, 1 to 2, 2 to 3, 3 to 4. I want you to check in with me. You know, you're gonna physically check in with me at these steps. But you may have them do some virtual check-ins too, and there's a lot of great HIPAA compliant tools for virtual check-ins, and that is just really, you know, they're all over the place. Some are more dynamic and interactive. Some you're gonna have to make your own decisions, but I'd be glad to introduce you to some of these that are out there. But basically, in a nutshell, you shouldn't be progressing. If you can't get that with the chewies, if you can't get that aligner to fully track and engage after maybe 2 days of switching, using your chewies for 3, 4, 5 times a day for 20 minutes, you need to stop and go back to the last aligner and wear it for another week and use your chewies and then move on. So the biggest mistake that we see a lot of times with patients is that they'll be coming in and there's a space between their aligner and their teeth. And it's like, well, how did you get that far off track? You know, if you empower them that they need to stop and go back and wear their old aligner and take another week before they advance, and if it still doesn't work, to call you and come in or to take pictures or whatever, they'll never get off track. And if they never get off track, you don't have to do revisions, refinements, or mid-course corrections, which saves you a heck of a lot of time. It saves the patient a lot of time. And this is assuming you have a great treatment plan and the patient's being compliant. But it's just really a simple trick for success. And you know, if patients have a great experience with their aligners should be a great experience. They're actually great. They're fantastic. It's a great way to move teeth. They're fairly comfortable. You can still have a normal eating pattern, a normal social life. But the biggest frustration for patients is just getting off track and just the constant spinning in circles with their cases.